Hi, Mr. Rayborn. My name is Alyssa. I will be your nurse today. What brings you in?
Annual checkup.
Annual checkup. Okay. Any issues with cold, recent cold symptoms, flu, any issues at all?
Nope.
Okay, great. Any pain at all today, anywhere?
No, his back's a little sore, but I played golf today.
Okay, great. On a scale of 0 to 10, if you had to rate it from 0 being no pain, 10 being extreme pain, what would you say it is?
2.5.
2.5. Is it in one certain area? Does it radiate? Does it move?
It's just lower back from swinging golf, but I'm fine.
Okay. Do you need to take anything for that pain normally?
I took some Tylenol, I'm good.
Okay, great. And that helps the pain?
Yeah.
Okay, perfect. So since you are here for a wellness visit, we are going to talk a little bit about your medical history. So I'm going to just write the notes, if that's okay. Any present illness now? You're good today? No signs of cold, flu, nothing like that? Okay. Childhood illnesses. We're going to go back a little bit. Any issues in childhood? Asthma, diabetes, any issues at all?
Yeah.
Okay, could you tell me more about that?
Oh, I had asthma as a child.
Okay. Now, are you still being treated for asthma?
Nope.
Have you grown out of it? Okay. How about any surgeries as a child?
I don't think so.
Okay. Any hospitalizations at all?
As a child?
Yes.
Yeah.
Okay. Can you tell me more about those?
I had pneumonia when I was like 10.
Okay.
I was hospitalized for it.
Okay. And you were hospitalized, and that didn't have any long-term effects. You're not on any inhalers, any issues with asthma?
Nope.
Okay. Any surgeries as a kid?
I don't think so. Not that I recall. No,
Okay.
I don't think so.
Any broken bones?
Oh, yeah.
Okay. Can you tell me more about those?
Which ones?
Sure. Just a brief list is fine.
Any particular order?
No.
5th metatarsal, 5th metacarpal, both hands, 4th metacarpal, both hands, all of my fingers, 3 ribs. That's about it, I think.
Okay. Did you have to have surgery for any of those?
No.
Okay. All right. Any major trauma? Car accidents? Any issues like as a child? No traumas. Okay. All right. How about adulthood? Any adulthood illnesses, accidents, injuries, anything from teenage on?
Partially tore my patella
Okay.
tendon.
Uh-huh.
Broke my kneecap.
How did that happen?
I fell down.
You fell down?
I fell down.
Okay. Did you have to have any type of orthopedic visit? Did you just go to the ER?
Yeah.
What came of that?
Yeah. ER didn't do surgery.
Okay.
I probably should have.
Did they suggest surgery?
Yes.
Okay. And you didn't follow up with
No.
surgery? Okay. Any issues with the knee now?
Yeah, it hurts.
All the time?
Yeah, occasionally, like when it's cold out.
Okay. So maybe some arthritic pain?
Yeah.
Okay. Do you take anything for that?
Tylenol.
Okay. Okay. So any current or recent, I should say, hospitalizations as an adult? No? Okay.
Mm-hmm.
How about vaccination status? Are you vaccinated for COVID and or the flu?
I do not take vaccinations for flu.
Okay.
I did one vaccination for COVID.
Okay. So you're vaccinated for COVID. Okay. How about allergies?
Got them all.
Medication allergies, specifically. Any medication allergies?
No.
Okay. Seasonal allergies otherwise?
Yeah.
Okay. And do you take anything for that? Any,
Zysol.
okay. And that seems to help?
Yeah.
Okay.
My wife has cats. I'm highly allergic to cats. So
Okay.
I take Zysol every single day.
Okay. Do you do anything else like a Flonase
Yeah,
or
I got
just
some
avoiding the
those.
allergen itself? Okay.
I can't avoid them. They're my wife's cats.
Okay. Any reaction when you, I mean, seasonal allergies is just runny nose. What about when you're around the cats?
Yeah, my eyes get puffy and snot starts uncontrollably running out of my nose.
Okay.
It's actually pretty gruesome.
Okay. So maybe try to avoid the allergen if at all possible.
They're my wife's cats. They live in my house. I can't avoid them.
Okay. Cancer screenings as an adult. You are 43?
I'll be 43 next month.
Okay. So you are coming up on 43.
Yep.
At 45, they recommend colonoscopies. So make sure you think about that for the next couple years here. It'll come up before you know it.
Thanks for ruining my next couple of years. Appreciate it.
You're welcome. Prostate screenings begin at 50, so also keep that in mind. And do you have any siblings that have any history of cancer? No? Okay, no. Okay. So we can talk about that next year as well. Moving on, I'm going to talk about tobacco use, alcohol use, any tobacco use.
Vape.
Okay. How often do you vape?
Daily.
Daily. Okay. And how long have you been doing that?
Couple of years because I quit smoking.
Okay. When did you quit smoking?
When I met my beautiful wife.
Okay.
She convinced me not to smoke.
Okay. So still vaping. Any thoughts on cutting down or cutting back?
No.
Okay. Maybe we can revisit that the next well visit. Alcohol. Are you a drinker?
Yep.
Daily, socially?
Daily.
Okay. How many drinks per day?
Depends on the day.
Roughly.
Only in days that end with Y.
Okay. Rough estimate, how many drinks per day?
Midweek, 1 or 2. Weekends, a few more.
Okay.
Few meaning a lot.
Okay. More than 5? Okay. All right. Does it affect your day-to-day life? Any issues with alcohol? Any withdrawal symptoms if you don't drink for a few days?
No.
Okay. In terms of diet and exercise, what does that look like for you? What's your typical diet, or what you eat day to day?
I'm a foodie. I love to cook, so.
Okay. So you do a lot of at-home cooking.
Yes, tons.
Do you use a lot of salt or seasoning, things like
Lots
that?
of seasoning, lots of butter.
Okay. So maybe some lab work in your future. Have you had recent labs?
No.
Okay.
They're coming.
Okay. Right.
I do my annual where I check labs.
Okay.
Yearly.
And they've been good
Always.
with your primary? Okay.
Cholesterol's great. Blood pressure's great.
Okay, so you follow with your PCP every
Yep.
year. Okay, great. So cooking at home, exercise.
What about it?
Do you have any sort of exercise routine? Do you lift weights? Do you go walking or jogging, anything like that? I know you said you went golfing.
Does that count?
Did you walk or did you take a golf cart?
A card.
Okay, so no, it doesn't count. Do you do anything outside? Any outdoor activity?
If I'm running, you should be running.
Okay, so maybe that's something we need to talk about too. Explore further on that. Exercise. Okay. Any safety concerns, safety issues at home where you
No.
live? Okay. In terms of mood, any issues with anxiety, depression, any super highs, super lows? No issues? Okay. And then neurologically, any issues with headaches?
No.
Confusion that you've been told about?
No.
Okay, so then just a couple silly questions. What day is today?
Friday?
Friday. Okay, can you tell me the date?
8th.
Okay. What month is it?
March.
And what year?
2024.
And who's the current president?
Joe Biden.
Thank you. Okay, so no complaints today, just coming in for a regular wellness visit. I'm going to ask a couple of questions, well actually quite a few questions about common health problems. So if you have any of these symptoms, just say yes and we'll talk a little bit more about it. Okay? All right. Any sleep changes, appetite, weight issues, fatigue, fevers, chills, night sweats, anything like that?
No.
Any issues? Okay. Rashes, hives, lumps, sores, itching, dryness, any changes in skin, hair, or nails recently?
No.
Okay. Any vision issues, changes in vision, blurriness, double vision?
No.
Okay. Any hearing trouble? Hearing aids, recent hearing loss, hearing
No.
changes? Okay. Any ringing in the ears or dizziness?
No.
Okay. I know we talked a little bit about the stuffiness and the issues with allergies in your nose. Anything else going on? Any
No.
postnasal drip? Any bleeding? Nose bleedings? Okay. Teeth, gums, bleeding gums. Any issues with your tongue, swallowing, painful swallowing? Any
No.
issues? Okay. And you see a dentist regularly, correct?
Sure.
Okay. Any cough, chest pain, trouble breathing, anything like that?
No.
Okay. Any issues with dizziness, falls, No chest pain, discomfort, palpitations, anything like that. Fast heart rate.
No.
Okay. We don't take anything for your heart. No blood pressure medication.
No.
Okay. Belly. Any issues with constipation, diarrhea, diet issues?
No.
Okay. Heartburn. I know we talked about that. We're gonna start the omeprazole again. No issues with indigestion, gas, bloating. things
I
like
mean, indigestion, heartburn, kind
Okay.
of go hand in hand.
In terms of bladder, any issues? Urinary frequency,
No.
any issues emptying your bladder completely, any
No.
burning, symptoms like that?
No.
Okay. I know you talked about low back pain, and that is just because of the golfing, right? That's not like an everyday occurrence, or is it?
No, it's just
Okay.
that.
Okay. So no other issues with joints, swelling, tender, anything like that?
No.
Okay. Vasculature, your fingers, ends of your feet, any issues with a cold, flu, things like that? Any tingling, numbness? No? Okay.
Wife tells me my feet are cold all the time, but
Okay. It doesn't bother you?
it doesn't bother me.
Okay.
Bother her.
Okay. Neurological, dizziness, headaches, we went over that. No issues there, right? Okay. No history of seizures, weakness, paralysis.
No.
Any recent heat or cold intolerance? Any excessive sweating, excessive thirst, hunger? Any of
No.
those symptoms? Okay. And then very lastly, I know we talked about no anxiety, no depression, but no nervousness, no insomnia, any hallucinations, things of that nature.
No.
Okay. Is there anything that you need from me today? Anything I can help you with? Any questions about your health or screenings or medications?
No.
Okay. We will go over the omeprazole and some lab work that you should look into and talk a little bit more about diet, exercise, and some education on alcohol and tobacco. If that's okay.
Sure.
Thank you so much.